This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Gretchen Kimmick, Associate Professor at Duke University School of Medicine and a breast medical oncologist. Welcome back.
Oh, thank you. It's always nice to be here.
And as a breast oncologist, I know that one of your areas of interest that you've talked to me about is this Taxane delivery system. And I'm wondering if you could share a little bit about what we've learned here.
Well, this morning at the breast cancer oral presentations, we talked about schedules for taxane administration, and it turns out we've been using dose-dense therapy. And one study that was presented was the CALGB study looking at AC versus Taxol. And it turns out that Taxol wasn't as good as AC. It was actually less toxic, but wasn't as good. So that was a good thing to learn. And then the presentation that just followed that was actually looking at Taxane's schedule. And they studied Taxanes given dose-dense, like we do, every 2 weeks with growth factor support versus weekly. And both of them for about 12 weeks at a time. It turns out that they were equal in terms of efficacy, but the every 2 week was more toxic, more myalgias. There was more cytopenias in the every weekly, but they were having their blood counts checked every week. So, and their rate of complications like hospitalization and fevers and infections were still equal in the two arms. So a lot of us are going to go home and look at the regimens we're giving and talk to patients now about, instead of getting a schedule which may be more tolerable of every other week, coming in and getting treated, they could get weekly treatments and actually have the same outcome. Now, I think some of my patients will still choose the every other week schedule because of the weekly visits just being very difficult, so they travel a long way. But the weekly treatments are just as good and less toxic, and that was very. I think it's going to change a lot of people's practice.
Dr. Gretchen Kimmick, Associate Professor at Duke University School of Medicine and a breast medical oncologist.
Thank you.